Hello, doctors. How are you?
Yes, sir. Yes, sir. Please go ahead. We are fine.
Yeah, I, I see Dr. Amina, Dr. Rajesh.
Rajesh. Yes.
Yes,
You will join.
maybe
Yes, sir.
Dr. Majin will join us. Okay.
Okay.
Introduction to know each other. I'm Omar Yousry Mustafa. I'm consultant orthodontist here in Cairo. I'm lecturer of orthodontics in Cairo University and lecturer, clinical instructor, program director at Perfect Braces Academy. I have my primary degree and my master and PhD from Cairo University, and I have membership fellowships from the Royal College. And I also have a membership in the Faculty of Dental Trainer from the Royal College in Edinburgh. And I'm certified lecturer, supervisor, and program director for the MOrth work, my study. I'm married, I have 2 kids, and I love traveling. This is my fun part. I love traveling, swimming, reading, watching movies, and hanging out with friends. I traveled more than maybe 16 countries around the world. And I try to balance between work, family, and the fun. Okay, let's start with to know you, Dr. Amina. Can you tell us about you?
Yeah, Dr. Amina, please introduce yourself.
Hello, this is Dr. Amina. I'm connecting from Coimbatore, India. I have my private practice. I've
India,
completed my
yes.
BDS. Yeah, BDS from Enapaya Dental College, Mangalore. And I've been a general practitioner.
Dr. Rajesh?
You are working as a general dental.
Yes, sir. I'm working
General
as a general dental
practitioner.
Yes, yes. Sir. I have
For
a
how
clinic
long?
and I'm practicing. Almost 10 years now, sir.
Yeah.
Yeah, sir.
10
Dr.
years.
Dr.
But
Omar,
you don't
Dr.
work at orthodontic. You don't have orthodontic practice. You don't work at orthodontist at all.
I do have patients coming seeking for orthodontic treatment, but we have a consultant who comes every month, and we have patients, and she takes care of those patients in my practice.
Yeah, but you yourself, you don't have a previous experience in orthodontics.
No, sir, no.
Okay. Okay, and your private practice
But I have
in
assisted the
India.
consultant. Yeah, but I have assisted her in her work. So I do have an idea, but I haven't treated anybody independently.
Okay, work. Okay. You are married, Dr. Amina?
Yes, sir. I'm married and I'm blessed with 3 children. And apparently my daughter is also Khatija.
Khadija. Yeah, this
Yes,
is very good.
my elder one is Mustafa, my daughter is Khatija, and I have a younger one, Hamza.
Okay. Okay.
Inshallah.
Yeah, Dr.
So you have
Rajesh,
3
sir?
kids.
Yes, sir. 3.
Khadija,
The younger
Mustafa,
one is
and
just 6 months old. I'm actually in my maternity break, actually. I'll be joining very soon, getting back to work.
Okay, very good. And what are you doing for fun besides family and work? Do you have any time more?
So I read a lot of books, and most of my time I don't have spare time as such, because I'm a busy working mother, taking care of my household, and I read a lot of books. I can say that that's been a hobby from a very long time.
Reading, very good. Reading is very good. Okay, nice to meet you, Dr. Amin. Very nice to meet you.
Yes, sir. Pleasure is mine.
Okay, and
Thank you.
Dr. Rajesh.
Good afternoon, sir. My name is Dr. Rajesh, and I'm actually a orthodontist. I work in. I graduated from Courts Mangalore in '97 from BDS, and I did my masters in AB City, Mangalore.
Yeah, you did your master in 2000?
2001, sir. I finished in 2001.
Yes, master degree. Okay, so you are working as a orthodontist maybe more than 20 years now.
Yes, sir. Yes, sir. I'm actually working in Bahrain, actually, in a private center.
Where? Private
I'm
center
actually
where?
working in Bahrain, Kingdom of Bahrain.
Bahrain, yes.
Yeah.
Okay. And you have kids, not kids,
Yes,
maybe
sir.
young men.
No, they're 18 and 16 actually, two girls.
19 and
Uh, the,
16.
the elder one is planning to go for psychology, so we are little busy with that work
Psychology.
as well.
Not he is not willing to be a dentist or orthodontist.
I think they've seen the struggle what I have been through, so I don't think they want to go to the same.
Okay. Do you have time to make some fun in your life?
Yes, I do. I actually do read a lot of books. I am an
Really?
ardent
Also.
mountain bike rider. I have a Harley which I ride every Fridays, which is the holiday we have here. So yeah, that's right.
Okay. 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 Very good. Very nice to meet you, sir.
Very nice, very nice to see you.
Okay. Let's talk. I know everyone is looking for an aim in his life, and is taking steps towards this aim. For example, when we are applying to this program as membership, either you are starting training from the scratch, like Dr. Amina, you want to learn orthodontics, or like Dr. Rajesh here, he just want to have preparation for the exam and getting the certificate. So we all have aims or objectives in our mind, and we want to be qualified and certified. Maybe for Dr. Amina, or for one who's starting orthodontic career, he or she wants to have knowledge, skills, and of course have the certificate that of the training, and have the certificate that she is a qualified and certified orthodontist. So orthodontic career, actually I love orthodontic career. I work for orthodontic career more than 15 years. So we make a good money, good profit. We make change in our patient's life, and we are having a respectful career, respectful job. I think it's an ideal job, an ideal job. There is also some disadvantage or some pros and cons, like we see, but I think the advantage is much more than the disadvantage. Maybe the stress, the dealing with patients for a long time, having some Dr. Rajesh will agree with me, some relapse cases, some difficult patients in communication. But overall, it's a good career. It's a nice job. Orthodontic.
Very much.
Okay, very good, very good. We have some problems, but the advantage is much more. We have a lot of change. We are making natural smile. I'm calling the orthodontists are natural smile makers for our patients. We are enhancing the esteem and happiness in our young patients. Orthodontics mainly deal with dent-facial growth and development, diagnosis, prevention, perception, and treatment of malocclusion and dent-facial anomalies. So we are treating mainly three problems: malalignment, malocclusion, and malformations, dent-facial malformations. We are changing the teeth from this to this. We are changing the smile from asymmetric smile, bad smile, to good, harmonious, beautiful smile. We're creating natural smile with natural alignment, good occlusion, better health, better function, better aesthetics. And of course, we are hoping for stability of these results. And I think, as I told you, it's a good job in many ways. But it's a difficult job, and it needs work and study and skills and a lot of experience to be a successful orthodontist. Mainly, I think successful orthodontist is the one who having three points. He's having the knowledge and the experience to diagnose and treatment planning for his cases. Diagnose treatment planning, this is the first one. Number two, to know his tools, the appliance and the materials, the biomechanics, to know how to apply biomechanics, to apply wire bending, to apply different appliances to his patients in order to achieve the treatment plan. And number three, and it's very important, to have communication skills, good communication skills with your patient. Because maybe the surgeon, for example, he doesn't need very good communication skills. He needs just information and skills about his job, about the surgery, but he does not communicate with the patient much more. We are communicating with the patient every visit. We are explaining for the patient the problem. We are explaining the treatment for the patient, and they are it's a subjective treatment. We discussing the aesthetic and the proportion with the patient. We struggle to make our patients improve their oral hygiene, improve their cooperation with elastics and appliances and so on. So if you are not communicating well with your patients, you will lose a lot of your patients, and you will not be a successful orthodontist. So to be a successful orthodontist, you need diagnosis and treatment planning. You need to know knowledge of appliance and materials and biomechanics, and you also have to communicate well with your patients. Then there is another 2 points. There is what I call para-ortho, because we are not dealing just with alignment of the teeth. We are dealing with periodontal problems, TMJ, medical conditions, different pathological and developmental problems. So we must know a lot, or must know about the dental and medical problems, or medical and dental disciplines around orthodontic. And also you must know to do research, or to read research, at least to read the research, to understand the research, and to know how to learn, because it's a dynamic world now. Science every day changes. So these 5 parts are the main components of the program, because we want to have very good diagnosis and treatment planning. We want to know very good biomechanics, appliances, materials of our orthodontic practice. And also we take some points about communication skills, ethics, and the clinic management. Some para also points, periodontal, TMJ, like this. And we learn how to read research, how to update our knowledge, because this is very important. Because what we are learning now, after 10 years, may be an obsolete, maybe a history. So this is mainly the topics we are studying in our program: normal growth and occlusion, malocclusion, classification, etiology, diagnosis, our tools, and orthodontic tooth movement, treatment, different treatment, preventive, interceptive, orthopedic, orthodontic, orthognathic, adjunctive treatment, retention, relapse, and also basic dental knowledge, basic medical knowledge, infection control, photography, aligners, and recent techniques for acceleration of orthodontic tooth movement using laser, 3D imaging softwares, maybe some knowledge about and a lot of topics that are needed to be a successful orthodontist in your practice, and needed to be certified. It's important. All these topics are included in the exam of the membership. So it's not just orthodontic exam. Maybe 50% of the exam is about para-ortho and research and basic medical and dental knowledge. So we need to study all the points included in the exam. And I think all these points are good for your practice also. Okay, the exam measure actually the knowledge and skills of orthodontics, as I told you, and understanding of the guideline and regulation and ethics and United Kingdom legislation. So we took in our program some legal points and some medical legal issues according to the British guidelines, and also the English language and communication skills. It's important to have because the exam is conducted in English, so you need to have good accepted level of English language. Actually, MOrth or membership for orthodontic in the Royal College Edinburgh exam is consists of two parts. Part A is 180 single best answer question. Single best answer question means that maybe we have it's now not online. It's in the COVID-19 it was online. Now it's not online. It's offline exam. It conducted in Cairo and in Dubai, and in I think last time they make exam center in Bahrain also. It conducted in different cities around the world, so it's easy to have the exam, and it conducted every 3 months, so you can have your exam very simple. You book your exam through the website, and it costs about 250 English pounds. The exam consists of 90 questions in 2 hours. Then you take a break for half hour, and then you have also 90 questions in 2 hours. So it's 180 single best answer questions. Questions in the exam are like this. They are giving you a clinical scenario. Most of the questions are like this, giving you a clinical scenario like this. 8 years old child with unerupted central incisor, his apogee showing 2 tuberculate supernumerary, preventing the eruption of the 2 central incisor, and the space for the unerupted incisor is only 13 millimeter. What would you do? And if you look at the options, they are very similar to each other. It's very close to each other. And maybe we have more than one option right, but we need to know what is the best answer. This is why they call the exam single best answer exam, SBA, not multiple choice, because multiple choice we have one correct answer and other answers are wrong. But here maybe we have more than one correct answer, but they are looking for the best treatment plan, the best answer. So we have guidelines for each and every clinical scenario, because we have steps for treatment, and we have guideline for each problem: impacted canine, impacted central, how to deal with bad prognosis first molar, how to deal with high canine, how to deal with cross bite, how to deal with open bite. And according to those guidelines, British guidelines, we are answering the question in the exam. So, for example, for this question, we have management of unerupted central incisor. We are studying this guideline, and we are telling you how to look at the question in just 1 minute, because you need to answer this question in just 1 minute, because you don't have time in the exam. You need to answer the question in just 1 minute. So you need to know exactly how to look at the question, which answer to choose very quickly. So every point in the exam, every point included in our curriculum, we have guideline. We have specific guideline and specific rules to answer the questions. This is about part A. Then we have part B exam. Part B exam is consists of 3 sections. Section 1 are 4 cases, diagnosis, treatment plan. Section 2 are treatment mechanics, also 4 cases. And section 3 are communication scenarios, 4 cases. So you have overall 12 cases in the exam. This is this exam might take 3 or 4 days. The exam is not conducted in 1 day, so you will have to go through the exam maybe for 3 or 4 days. Every day you have 3 or 4 cases, and the examiners, maybe you are introduced to more than 12 examiners. Of course, the examiners are British. and they are coming from the Royal College of Edinburgh. So you need to know how they think. You need to know how the British orthodontists think about their cases, how they deal with their cases. So as I told you, we are studying the guidelines, we are studying the medical legal, we are studying the British school of orthodontic treatment, because it's slightly different in some way between maybe the American school or the different schools of orthodontics. So we need to study from the British way, from the British point of view. Okay. Diagnosis and treatment plan sections, you are giving, you will have a case like this, records for a case, intraoral, extraoral photos, panoramic X-ray, lateral sphenometric, and maybe some reading of the lateral sphenometric. And you are having, they're giving you 10 minutes to look at these records, and then you will subject it to discussion for 30 minutes with the examiner. They are asking you about diagnosis, they are asking you about treatment planning, treatment options, they are asking you about every point in the diagnosis. How do you see the panoramic view? How do you see the lateral sphenometric? How do you evaluate these records? How do you look at the intraoral examination? What can you see in molar relation, canine relation? They're asking about how to evaluate crowding, how to evaluate curve of Spee, how to evaluate the antero-posterior relation in the lateral sphenometrics, how to evaluate the vertical growth of the patient, how to evaluate the skeletal age of the patient, dental age of the patient, what do you see about the pathology in the panoramic view, everything. And they ask you about the treatment plan and the treatment options and the treatment sequence, from starting from improving the oral hygiene, treatment of any pathology, informed consent, how to make informed consent with the patient, and leveling alignment mechanics, interarch mechanics, finishing of the case, and also the retention of the case. They're asking you about everything in the case. Okay. Maybe asking about case summary, problem list, how to evaluate different problems, treatment objective, options, plan, and treatment sequence. Section 2 is a mid-treatment records. They are giving you mid-treatment records. They are giving you a picture of mechanics like this, and they're asking you, what do you see? What is this mechanics? What is the aim of this mechanics? What is the anchorage? What is the problem? What is the alternative mechanics we can have? Maybe they ask you about that temporary anchorage device, loops, piggyback technique, cantilever spring, everything. And they may asking you about the appliance, MPT appliance, Roth appliance, sliding or non-sliding mechanics, maybe the material of the wire, TMA wire, stainless steel wire, the material of the retainer, acrylic, the material of the bonding, composite, and the glass ionomer. They ask you about iatrogenic effect, gingivitis or periodontitis or aggressive periodontitis or white spot lesion or root resorption, any problem associated with treatment mechanics or appliance or biomechanics. Okay. And then section 3 is about scenario. They are giving you a scenario, a written scenario like this. For example, mother wants orthodontic treatment for her child, but she does not want any teeth to be extracted. The child has a very crowded dentition and need extraction orthodontic treatment. And there is an actress, there is a male or female actress or actor coming to you, and they pretending they are the patient, or that is the parent of the patient. And for 10 minutes, you have to discuss the treatment plan with this actor. So you are not talking to the examiners, you are talking to an actor, and the examiner is watching you, and you are not supposed to look at the examiner, and you are not supposed to talk in a scientific way. You shouldn't tell her about space gaining methods and how to treat the case of crowding. No, you are talking to a patient. You just tell her, your child mouth is very small, we have a lot of teeth, we need to pull out 2 teeth to have a space to straighten his teeth and so on. So you are slowly and very clear describe the problem for the parent or for the patient. You are telling here about the treatment options, different treatment options, and the steps of the treatment in a plain language, not scientific language. And you are being evaluated according to your communication, your body language, your eye contact, your voice, your attitude towards the patient, your active listening to the patient. How did you introduce yourself to the patient? How did you finish your talk? How did you answer her questions? How would you listen to her and have empathy with her, and so on? So this part is actually about communication. They also evaluate your scientific knowledge when you are telling her about the options, but mainly about your communication, your attitude. Even your clothes and your appearance are being evaluated. Your setting, your body language, your eye contact are being evaluated. There is a degree for every point. So this is part B exam. After having, inshallah, success in part A and part B exam, you are giving membership in orthodontics. Membership in orthodontics actually is a very respectful certificate, because you will give a certificate in any country around the world. It should be if you are having membership, you are usually a specialist in orthodontics, and after 5 years, when you have the fellowship, you are consultant orthodontics. So this is why MOrth. But why perfect braces? We have different consultant orthodontists in our instructors team. We have a condensed teaching program and flexible at the same time. We have lectures, seminars, case presentations. Every semester, every 3 months, actually, we have exams simulating the exam of the Royal College. We have clinical training. We have external courses, conferences, assignments, journal clubs, and we have a very useful preparatory course for part A and part B exam. Okay, those is mainly our sources in studying: Bristol postgraduate notes, textbooks like Handbook for Orthodontics, modules of British Orthodontic Society, guidelines from the GDC and British Orthodontic Society, NICE guidelines, WHO, research and evidence, and we also have handout and example questions. For the 3 years program, if you are intended to have the 3 years program with us, we have pre-clinical course, we have clinical and theoretical course, and you are also having the preparatory for part A and part B included within the 3 years program. 3 years program is 4,500 hours training, theoretical, practical, and research. You are making treating 20 cases at least, and you are making more than 1,000 case discussion with your colleagues. We're having a lecture every week for 3 years, so it's about 150 lecture and 150 seminars and periodic exams. For part A preparation, you will have 3 months revision. If you are already finished your training, 2 years of training at least, or if you already have master degree and you are applying for part A preparation, you will have 3 months revision. We are following the blueprint of the part A exam. It's about 40 topics. Every topic we are studying the main points, important information about this topic, and the previous questions from the exam. You will have overall for the 4 topics about 1,500 questions from the previous exams, and actually more than 50% of the exam is repeated from previous exams. So if you are studying these questions very good, you will be able to succeed if you are understanding the question, because they may change some words in the question to change the answer. But if you are understanding the question very, very well, you can pass the exam very simple. And alhamdulillah, we have a high success rate. Last exam, we have 12 candidates succeed from 14 candidates. It's only 2 candidates because they have personal problems or they don't study well. But most of our candidates are succeeding from the first time. So because repeated questions and questions are being repeated in the exam, questions are already known, most of the questions, and we are covering all the topics included in the blueprint for Part A exam. And you will also have 2 mock exams. We'll make 2 mock exams for you to evaluate you and to evaluate yourself to know which topics you need to study more. If you have any problems in answering the question in the mock exam, and you will not get the certificate for Part A exam unless you are having 2 years training with us, or if you are having the preparatory course and passing the mock exam with us. Okay. And these are the topics for the Part A preparatory course. Okay. Part B preparatory course, it's 6 months revision. It includes the 3 sections of Part B exam: diagnostic treatment planning, appliances and mechanics, and also communication scenarios. We are discussing more than 100 cases in different sections. And you also have 2 mock exams. You should pass those exams before you get the certificate for Part B exam. Okay. It's not an easy work, but it's worth every minute, because the best investment you will make is to invest in yourself, to invest in your career, to improve your knowledge, improve your skills, and also improve your certifications. We are working smart because we have flexible table. We have online lectures. We have you will have an account on the website. You can listen to the lectures more than one time. You will have a handout to study. We are focusing on the most important points which you need for your practice and for your exam. Don't settle for the minimum. You are responsible for your success. We are creating the environment to you. We are giving you the tools to success, to pass your exam, but it's your responsibility. You should study. You should memorize the questions. You should memorize and read the books. And every day, take one step. It's not about one huge step. It's small steps towards success. Every day we will take 2 hours lecture, and you need to study those points in the lectures, maybe 5 pages, 6 pages. But by the end of the program, you will find yourself with a huge knowledge and huge skills, inshallah. Okay. And as I told you in the beginning of my lecture, it's about balance in work, study, family, fun. It's not easy, but this is life. You need to balance between all of these items to have a balanced life and successful life, inshallah. Okay. I'm waiting for any questions or any comments. And I welcome Dr. Mateen.
Yeah, Dr. Mateen joined. He was a bit late. Yeah, any questions, Dr. Rajesh, Dr. Mateen, Dr. Amina?
No, absolutely no question.
No.
Yeah, unfortunately, there was a traveling, so
no problem. The lecture will be recorded. This lecture is recorded and will be available on the website for free if you want to listen to it again.
Yes, of
and
course. I will ask Dr. Rajiv.
Yeah, okay. Maybe after 2 weeks from now, we will start Part A revision. And for our program, we are starting the preclinical course also.
Yeah. Dr. Jaideep was not available today. He has got fever. So I will send recording to him. So, sir, we can start our Part A revision from next Thursday.
Yeah, maybe
I'll confirm everything and then we'll discuss.
I will confirm with you.
Yes, sir. Yes, sir. Thank you very much. Thank you,
Thank you,
doctors.
Dr. Ravi.
Thank you,
Thank
doctor,
you.
very much.
Thank you. Thank you.
Bye-bye.
Nice to meet you
Bye.
all. Thank you
Bye.
very
Have a
much.
good days ahead. Thank you.
Thank you, doctor. Thank you.